Today we're going to talk about having full mouth reconstruction all in one day. Now it may sound like it's impossible, but it's not. Dr. Daria Hamrah of NOVA SurgiCare is here to tell us all about it. Good morning, doctor.
Good morning.
So you know what, at NOVA SurgiCare you do many things.
Correct. We're a comprehensive center that provides care for patients that are in need for any sort of head and neck reconstructions, and obviously the jaws and the teeth belong to the head and neck. So today in particular, I wanted to talk to you about how patients that are needing oral rehabilitation for various reasons, whether they've lost their teeth in accidents due to tumors, or just they've lost their teeth due to wear and tear.
Okay, so for whatever reason, if you've lost your teeth,
correct,
you can have a full set of teeth in a day?
That's correct.
It does sound impossible. So tell us about it. If you can kind of walk us through how, say someone comes in and they've got no teeth in their head whatsoever. You can give them a full set of teeth.
Absolutely. A lot of times patients are not aware of the possibility to regain their teeth in one day. And by regaining teeth, I'm not talking about just dentures that float around in your mouth, because obviously those are known to everyone, but I'm talking about teeth that are fixed to your jaws, where you can actually fixed via dental implants, where patients that had lost their teeth a long time ago, now they can eat hard foods like steaks, bite into apple, eat corn from a cob, things that they have actually forgotten about, where they had to compromise their
lifestyle, basically.
Lifestyles.
So, okay, someone comes to you, they want to get these teeth. What kind of substance are we talking about? What kind of teeth? What is it made of?
They're like teeth that our crowns and dentures are made out of, acrylics and porcelains, depending on what we're trying to achieve.
Wow. Now, okay, this isn't, it's not common knowledge. So, everyone's heard of implants. Are we to assume that every dentist who can give you implants can give you teeth in a day?
Unfortunately not, but it will be the future. There's studies that have shown that only less than 30% of dentists in the United States recommend dental implants routinely in their practices, and that goes back to training and to experience. The current norm is where dentists see patients, they propose a treatment plan, send patients to a specialist, to a surgeon, like I am, and then we do the surgery and send the patient back. At NOVA SurgiCare, we have a dental implant center where all the professionals are under one roof. We have a surgeon, which is me, a dentist, which come to our operating room, as well as a dental lab technician, which will custom build the teeth for the patient that day, so the patient can leave with those new set of teeth that are fixed via dental implants that evening, and they can enjoy a steak the next day.
Wow. And these teeth are custom made.
They're custom made.
For each person.
Absolutely.
Tell us, what kind of time investment are we talking about here?
Depending on how many teeth we're trying to restore. So we have obviously two jaws, an upper and a lower jaw. Depending on which one we're doing or whether we're doing both, it takes anywhere from 4 to 6 hours.
Wow.
From start to finish.
Not
and
bad.
That includes patients being under anesthesia, going to sleep, and waking up with a full set of teeth.
And
the total.
Depending on the patient, I guess that will determine what kind of whatever it's made of. For instance,
Correct.
if I just want teeth that are pretty.
Correct. Yeah, I mean, patients pick their own teeth sometimes. Sometimes we recommend certain teeth according to what we think fits their face best. So the face of your shape of your face will determine the shape of your teeth. Your age will determine how white the teeth should be. I mean, if someone is in their 70s, it's not natural to have pearl white teeth.
Right.
So you don't want, it's kind of like a cosmetic surgery patient. You don't want to give away that you had a facelift or...
There you go. Put them as natural as
Yes.
possible. And it's made here in the U.S.?
Absolutely. And even the implant systems are that we use at NOVA SurgiCare is the most sophisticated implant system, which makes it possible. And that's a U.S. company, and it's the third largest implant company in the world. So at all times, patients will find parts and components for their repair if they need repair.
Dr. Hamrah, I've got to say, people think, okay, this is great technology. I don't know if I can afford it. Is it affordable?
That's a very good question. Now, you know, like anything we purchase, anything we purchase has a value. So if you look at the long-term advantages and the long-term maintenance of these things, they're definitely affordable. You know, people forget how much money they spend over their lifetime on their teeth just trying to fix and patch them, and they keep breaking. Well, this, once it's there, it lasts a lifetime. Most of the time, it outlives the patients. So yes, it might be a little bigger sum in the beginning, which is now, due to the lower cost of implants, now affordable. That's why more and more patients end up getting these things. But over the long run, it saves the patients a lot of money. And you know, we all know during these economic times, patients look more for long-term goods rather than for short-term
And I suspect
fixes.
the best thing to do is just give you a call at NOVA SurgiCare, and you'll give them all the information they need. Dr. Hamrah, thank you so much for joining us on Let's Talk Live.
Thanks for having me.
And we'll have more Let's Talk Live coming up right after this.